Cancer is often a devastating diagnosis, especially during this pandemic, but many don't talk about the psychological turmoil that accompanies the disease, impacting your mental well-being. So as we look towards a rebound, ABC Action News is providing you with the tools and resources you need to manage these challenging times. New tonight, I spoke to a cancer survivor about what she learned going through her diagnosis and treatment, and her advice now as a patient advocate so you can heal your body and mental health at the same time.
Because cancer is a stigma and mental health issues are stigmatized, the combination is just deadly, and we don't talk about it enough.
Cynthia Hayes is a cancer survivor and now a patient advocate. She says a person's mental health is almost instantly impacted after receiving a cancer diagnosis.
Cancer is a psychological diagnosis, too. It drives our emotions in ways that we cannot imagine beforehand. And so it is perfectly normal to feel depressed. It is perfectly normal to be anxious, to be angry, to be confused.
And when you have cancer, there are real physical changes happening inside the body, which involve cytokines that allows the immune system to communicate. But the cytokines get out of balance as you go through treatment. And even though you think you should be positive and hopeful, you physically can't be.
Our bodies are telling us something else. They're telling us, climb back into bed. You are sick. You need to get better. And that's part of what makes the psychological experience so challenging, is that the external environment is telling us one thing and the internal environment is telling us something entirely different.
As for the caregivers, Hayes says it's important to listen and be supportive without judgment.
The challenge is to help the patient feel what they're feeling and really recognize what they're feeling. And then as the caregivers say, I understand why you're feeling that way, and I'm here for you.
And for the cancer patient, Hayes warns, don't withhold your fears and worries from your loved ones, as it creates distance and can destroy intimate relationships.
I always encourage the patients I work with to share. Just tell people what you're thinking and feeling, because they can't understand it.
There are nearly 2 million people in the United States who receive a cancer diagnosis every year. So if you're struggling psychologically, reach out for help and know that many cancer patient support groups are now online. Hayes is also the author of The Big Ordeal: Understanding and Managing the Psychological Turmoil of Cancer. We've shared a link to that and more information on our website at abcactionnews.com/rebound. Dennis?